Warning. This content can be disturbing to some audiences. Viewer discretion advised. The patient was having a major stroke and the nurse was too far up her own SS and her own phone to do an assessment. Doctors have read it. What was the worst thing you've seen for a patient that another doctor overlooked? Patient was lactating but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had been weaned for 14 months. Sent her immediately for a brain scan, brain tumor. She had surgery a week later to remove it and is doing very well now. This happened to me. My daughter was 5 years old and I was still lactating. My doctors didn't listen and told me my husband was playing with my breast too much. I went to my cousin, who is in Ob-Gyn, and she spoke with my doctor and he ran some test. Turns out I have a Rix cleft pouch on my pituitary gland. It was drained and came back. Due to other doctors not listening to me, it took another 8 years for them to find out I have Addison's disease. By then I shocked everyone that I was even alive. Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him, I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful, not a good sign. Sent him right away to have a chest X-ray that showed a huge mediastinal mass, suggestive of lymphoma. Sadly, I don't know what happened to him. One that comes to mind is when I was a resident, the ED doctor wanted to admit a mild septic patient with a UTI. I review her labs, and knowing that she is a diabetic, it was obvious florid DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the echo to get insulin via a drip and aggressive for fluid rehydration. She was just in the ED hallway with no medications at all, looking like crap. I suppose I have one for this as a resident doctor. We saw a kid in the emerg for difficulty walking. He had been slowly losing the ability to walk over months, and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip, then the other hip, gave some Zofran etc. Turns out on exam he is blatantly anorexic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me and I'm not even good at this yet. Did a CT scan. Big SS tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain and he went to ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. Edit. Thanks everyone. The history was that he really declined further over the last few days, prompting the ED visit, so he looked really bad for us, but I'm not sure what he looked like before. The symptoms however dated back months. To any med students reading this, 1. Do an exam. 2. It's okay to cry sometimes. Broken neck. No really? So, this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat CASR and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when he broke his neck. He had a brand new unstable neck fracture. Checking his initial x-ray, we see that it was there prior to the operation. After questioning the patient, he said that on his way to the hospital the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately, he passed away about 2 weeks later due to the CASR. As a patient, my eyes were hurting and I kept going back to my eye doctor, who insisted that the problem was that I wasn't cleaning my contacts properly and just kept giving me harsher and harsher chemicals. It got to the point where I couldn't open my eyes fully in a room with the lights on, and I hadn't worn contacts for months. Finally, After a year, my mom forced my dad to take me to a different doctor. Literally, he met me in the waiting room, looked at me with his naked eye, and said, "You have a raging eye infection." A month of antibiotics and the infection was gone, but there was so much scarring and damage it was 20 years before I could wear contacts again. Edit, getting this question a lot. I was a kid at the time, I didn't know the difference between an optometrist and an ophthalmologist, and it was over 2 decades ago. I do not remember if I ever knew, sorry I can't tell you. A lot of people are saying that optometrists are basically just for routine checkups and getting glasses or contacts, and if something is actually wrong and you need a diagnosis, go to an ophthalmologist. I don't personally know if that's true or not, but feel free to do some research. It's a thing several people have said now. I've only gotten the one troll so far showing up to tell me he is 100% sure I'm lying because that's clearly what people do for fake internet points and he will not have it, which seems low for a Reddit post. So, I'll take that as my good fortune of the day. Patient getting anxious about numbness in his hand. It's getting more frequent and I don't want to live like this, it gets me freaked out like my hand's not there. They assumed the person was suicidal and having symptoms of panic attack, elevated breathing rate, tingling, numbness in hands. They did a CT because I requested it, there was a lesion, they blew it off. MRI showed it was glioblastoma multiforme. Edit, clarifying, it was missed by the ER physician assistant. The MD supervising them never spoke to me. Not even sure if they reviewed the case. What is that? Glioblastoma multiforme? Glioblastoma, also known as glioblastoma multiforme, GBM, is the most aggressive type of cancer that begins within the brain. 6. Initially, signs and symptoms of glioblastoma are nonspecific. 1. They may include headaches, personality changes, nausea, and symptoms similar to those of a stroke. 1. Symptoms often worsen rapidly and may progress to unconsciousness. 2. We found it early actually. I'm in a different field so didn't follow up thereafter. I'm the patient in the story. When I was a toddler and started walking, my extended family noticed that I would waddle a lot. My parents didn't really notice it because they grew used to my funny walking, but my grandma and my aunts that saw me so much less often insisted that I had a limp. So, my mother asked our pediatrician about it and he reassured that it was nothing and would fix itself when growing. 1 year passed and it didn't fix itself, it got more noticeable. My mother asked again to my doctor, she asked for an x-ray to make sure everything was fine and the doctor bit her head off for wanting to expose me to the rays. He insisted it was nothing but referred us to a specialist anyway. The specialist suggested my parents put some wool around my leg that had the limp. Because wool would warm it up and speed up the growing process. Right. My dad finally had enough. It was summer and my regular pediatrician was on holiday. His partner visited me because meanwhile the limping became really bad and my parents wanted another opinion. The new doc measured my legs. There was a 4 or 5 centimeters difference between the two legs. They sent me to a specialistic children's hospital to get it fixed right away. I had severe dysplasia. So severe my right hip didn't have a socket for the femur bone. 3 years and 3 surgeries later, months of physiotherapy to learn to walk again, I was normal. If the second doc didn't catch it, I would have grown up disabled. He split up with his work partner, the first doctor. Second doc is now my daughter's pediatrician. Smile. My husband had a weird, dimpled spot on his back. Went to the dermatologist multiple times, was brushed off and told not to worry about it. Derm even burned off a nodule that was bothering him, at his belt line, but repeatedly said it was nothing and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist, since our experience was so negative. Next derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, triage and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so effing patronizing with our concerns and shove his face deeply into his own SS. Not a doctor, but a friend of my mom's went to an ophthalmologist for an eye problem. During his exam, he asked her, "So how long have you had MS?" That was the first she was diagnosed. She had been battling various MS symptoms for a couple of decades without a diagnosis. It's amazing how many diseases can be detected during an eye exam. Diabetes, cancer, multiple sclerosis, thyroid disease, lupus, rheumatoid arthritis, Lyme disease, brain tumors. Not a doctor, but I've been dealing with abdominal pain since a child, countless ultrasounds, doctor appointments, or visits. I was always told it was in my head. Recently had surgery for something unrelated. During the surgery they had to free my appendix that was stuck to my abdomen wall, and just the tip is healthy at this point. I've been suffering for years with a mild case of appendicitis, and my body was pretty much just absorbing my appendix. I will have to go back to get it removed at a later surgery because it was so stuck. All they could do was free it, and they didn't want to risk it at that point because it was going to cause more pain. So that was cool to find out. Not a doctor, not even a nurse. While working as a CNA on a NICU step-down unit, I noticed my patient was acting strange, asked her a few questions, got some questionable answers, thought it might be weird, as she couldn't really answer questions other than "huh." Her gait was weird, like a trot rather than a normal walk, plus she was leaning. I was training another CNA and I was like, no matter what you do, if you see something, notify the nurse and chart that you notified her. The patient was having a major stroke and the nurse was too far up her own SS and her own phone to do an assessment. The woman had to go to rehab and was not a candidate for any stroke reversing drips, as I had charted that she seemed off 8 hours before. The only reason anyone caught it was because the night shift nurse insisted on bedside report. The nurse I had been working with yelled at me, "Stroke?" Like I hadn't been notifying her of symptoms all day. Thank you for watching the video. Don't forget to like and subscribe for more quality content. Leave a comment if you have any suggestions. Goodbye.